Good morning, everybody. Tess Crawley here, clinical and forensic psychologist and director of Dr. Tess Crawley and Associates, and of course mentor to psychologists and other mental health professionals. It is about 9:30-ish. Oh no, gosh, where's the morning gone? 5 to 10. I'm just really going to give you a little bit of a follow-on from yesterday's video. I'm going to be sharing this. You might hear some snuffling in the background. Miles, come here. Got my wannabe therapy dog with me today. Let me introduce you. Come here. This is Miles. He's very cute. He's 8 years old, and he's been in training for a rather long time. He isn't getting official training at the moment, and all of you who have official AAT approved therapy animals, dogs or cats, I'd be really keen to hear from you how it's going, where you got your training from, and how your clients are responding, because I certainly know that we have had such a positive response. He's trying to get out of the consulting room because there are people in reception, and he just loves to make everybody feel welcome and happy. Now I'm just trying very quickly to find where we are going live into. I'm having a little bit of trouble finding it today. I might be on the wrong page, give me a minute, but I wanted to talk to you anyway about what we chatted about yesterday. We talked yesterday about the requests pardon me, that come from lawyers around access to client files. So we talked about that yesterday, so if you missed that one, have a look on yesterday's stream. I'm sure you'll find it if you dig around. It's in my groups. Here we go. Now I'm trying to share into our groups to get us all up and running for the morning. You see, I've got but coffee first. Seriously, I don't know about you guys, but mornings and coffee go together like, I don't know, something and something else. Here we go, let's get into our groups. So what I wanted to talk about today was the topic I sort of alluded to yesterday, which is what do we do when a client is asking for a letter from us when they've got a court appearance coming up. So I don't know how you guys find it, but we often have one of two things happen regularly in our practice. One of those is a client is referred for a disability, well, they might be referred for whatever the GP's referred them for, but the client's idea is that they're coming for a disability support pension letter of support, I guess. The other thing that happens is that we might have clients who are coming in the full knowledge that they're about to be experiencing some court matter, whether that's a criminal court or a family court matter, and they come and see a psychologist in the hope of getting some kind of what they often call a letter of support. Really thinking, I guess, that it's going to look good for them in court if they've got some kind of letter from a psychologist. Now, the fact that, of course, I'm a clinical and forensic psychologist, so that means that people often misconstrue my powers, if you like, to influence the court. So I'm interested to hear from non-psychologists, I'm interested to hear from generalist psychologists and others, how you handle these kinds of requests in your work. And I'm not just talking about private practice work either. I was speaking with a colleague recently about legal requests within her working environment, which is within an NGO organisation, and how her employer handles those requests. So if you are watching live, I know somebody is. If you're watching live, say hello. Let me know where you're working and how you handle these requests. But generally speaking, it does, sorry, I've got something in my eye. It does really matter what it is that the client thinks they're asking for. So sometimes a client will think that they're asking for just a letter of support. When you dig a little bit further, it actually sounds like what they really want is a formal report. And it might be that their lawyer has said to them, go off and get yourself something from a psychologist. So it's it does require you to do a little bit of inquiry about what the client has in mind. Now, if you have an ongoing client, so a long-term client, someone that you've known for quite some time, so I'm thinking here, I've got a number of clients who were referred to me as perinatal clients, and then I've seen them ongoing as clients dealing with parental adjustment, and then parenting issues, and then lo and behold, there might be a marital breakdown. So I've seen those clients through all of those progressions in their parenting journey. And sometimes they then might ask me for some kind of letter of support. Now, in those cases, when I know the client more or less intimately, for want of a better word, I can actually write something that is like a brief report or a summary of my interactions with the client, but I will still want to know what the lawyer is actually hoping for. So you need to have a little bit of knowledge of not just what the client thinks they're asking you for, but whether or not their lawyer has asked for this, and if so, what does the lawyer actually need? So it can be useful for you to call the lawyer with the client's consent and say, look, I've been asked for a letter of support. What is it that you actually need for court? What's going to be useful? Because I'm happy to provide a report, and if finances are an issue, that can be a brief report, but in terms of reference, and that's the term we use for the questions that a lawyer will ask you to answer when they're asking for a report. So terms of reference can be brief, can you just give me an overview of how engaged this client has been in therapy, and whether they're progressing well with management of anxiety or whatever it might be. Sometimes, especially in the family court, you might be asked to comment on parenting capacity. In the criminal court, you might be asked to comment on risk. So I want you to be really, really clear about the limits to both your role with the client and also your capacity to comment on those two questions. The reason why you get asked those is because people assume as a psychologist you're going to know the answer to those, but the problem is, as a treating psychologist, you're not, it's not your role basically to have conducted a formal risk assessment, and I mean by that, full risk of recidivism, risk of violence, all that sort of stuff. You might have done some of that within your therapeutic work, but that's not the core reason that you're seeing the client. It's not the same as an independent forensic evaluation, is what I'm getting at there. And same with the parenting capacity question. You might have some thoughts on parenting capacity based on the limited information you have. So the court is not going to take you very seriously if you're making sweeping statements about parenting capacity, because the court knows that you've not got access to all the information. It is very rare for a treating clinician to be given full access to all of the information in a family court matter. I know it does happen sometimes, but even so, your role as treating professional, it's your job to be on the side of your client, so the court automatically sees you as biased. So when you're asked to do things like comment on parenting capacity or comment on risk, if you're writing a report, you can certainly put your observations in, and if you've done any formal assessments, you can put those in too. But it is important that you comment on the fact that your the limitation is that you're the treating professional, you're not an independent clinician. So when a client is asking you for a letter of support, there's actually a lot more to it, really, isn't there? You've really got to be asking the client, well, what does that mean to you? What does that mean to the court? Do I need to talk to your lawyer and get some clarity about what your lawyer is thinking will be useful for the court? Because, of course, what the client thinks might be useful may well not be in line with what the lawyer thinks is useful. And I've certainly had cases like that in the past where the client has been running counter to the wishes of the lawyer, much to the lawyer's frustration. So it can be useful to have a chat with the lawyer and get some clarity there. When it comes to new clients, now this is a completely different ball game. So new clients who are turning up, you think they're turning up for therapy, turns out they want something for court. You're well within your rights to say this is not what you were referred for. You were referred for treatment under Better Access. Medicare does not fund court reports and forensic assessments and all those sorts of things. You're actually within your rights to say, look, if you're not here for therapy, then I'm not the right person for you. Or you can say, if you're not here for therapy, I'm happy to do a formal assessment and prepare a formal report. These are the costs involved. There is no Medicare rebate for that. So oftentimes people will slip through the radar. I find particularly with disability support pension requests, GPs are referring them to us for therapy, but the client really just wants a letter for Centrelink. Side note there, Centrelink only accepts letters from psychiatrists. Good morning, pal. How are you going? Centrelink only is interested in letters from psychiatrists and clinical psychologists. So if you're not a clinical psychologist, if you're not a psychiatrist, you can actually handle a lot of those requests quite simply by saying, look, a letter from me is not going to make much difference because Centrelink won't give it any credence. Same with a lot of the court-related stuff. You can actually, if you're not wanting to do any reports for the court, if you're not wanting to put yourself into that domain, you can actually rely on the fact that as a treating clinician, your report won't hold an awful lot of sway. And so I actually, with my clients that I'm treating, I will have that chat to them. You want a letter for court? I'm your treating professional. I'm already biased because it's my job to be on your side and I've only heard your side of the story. The court's not going to put any weight on my say-so. If they want an independent assessment, they'll ask for one. So I would encourage the client to save their money. Unless there's a very clear reason that the lawyer wants one, that's a different kettle of fish, of course, and then you talk to your client about costs associated with that. So whether it's a brief report or whether it's a lengthy report. So when your client is asking you for a letter of support, obviously, they're really hoping that you're going to be able to help them, and it's not always within your capacity to do that. So chat to them about the limits of your role, chat to them about, of course, you support them in any other way within the therapeutic framework, but perhaps maybe they need to seek some additional legal advice before following their line of thinking about what the court's going to find helpful. So that's it from me today. Now don't forget my Doors to the Quiet Confidence for Emerging Supervisors group. That's the subscription-based group. Those doors are open. They're open for a brief time. You need to jump onto the website, my website. I'm just putting the link in the comments here. And when you put in your expression of interest, hang on, I have to move this again. What you need to do, bear with me, I'll put in the comments. When you put in your expression of interest, it will send me an email letting me know that you've expressed an interest, which I'll be very glad to see. You will then receive an email that will give you a bit more information about the program. And in that email will be a link for you to follow, and that is the link to the subscription page. Pardon me. So you need to follow that link, subscribe yourself up. I can't subscribe you, you have to do it yourself. Don't forget your first month of membership is for free, so you've got a month to try before you're committed financially. You put your credit card details in with PayPal, and PayPal is set up so that your first month is charged at $0. So you get your first month free. And follow the process to join up. Now, I will be starting the dedicated live content for that program next week. So I'm going to be letting you guys know very soon, within the next day or two, exactly when and what time. I know the answer to the question, but I'm holding off and giving you a little bit of information at a time so you can digest it all without having to swallow it all in one great big gulp. So if you're interested, now the mentoring program is all about supporting you to build your confidence as a mental health leader. Now you might not be in a leadership role. It might be that you want to build up a team within your practice, or it might be that you want to build up the number of clinicians in your rooms, or it might be that you want to start being a supervisor. It might even be that you've been a supervisor for a long time, but you feel like you've lost your way a little bit and you want to sort of pump up your own tires again and get yourself back on track. So I'm not going to teach you how to be a supervisor. I'm going to teach you how to be confident in the skills that you've got, and how to really value the work that you do, and how to really feel like you could take on the world, because I know you can. That's it for me today. Have a fantastic day. It's Thursday today. Tomorrow's Friday. Can't believe it's nearly the weekend again. Have an awesome day. Take care for now. Bye-bye.